We're going to go ahead and get started. Let me thank everyone for joining us this morning. I'd like to start by thanking all of our city employees who have been working around the clock to keep the residents of our city safe and prepared. I also want to take a moment to thank our residents for continuing to be vigilant in doing what each of us can to limit the spread of this virus, including frequent hand washing, staying home if you're sick, keeping your distance, and may I add the awkward elbow bumps that are occurring around the city as well. I also want to thank the governor, Governor Polis, for instructing that insurance companies to make virus testing free, and for being such a good partner to the city of Denver, along with his other departments, as we work diligently to address this issue. There are some new developments in Denver involving COVID-19, and we just want to bring an update to you this morning. As you may already know, we have 2 presumed positive cases in the city and county of Denver. Now there are 8 people under quarantine. Our first priority continues to be preparing and protecting the people and families who live, work, and visit our great city. As you recall, last week I stood up a task force that was more internal of all of our agencies and our external partners, including Denver Public Schools and Denver Health and Hospitals, to help us really to monitor the situation in Denver. That includes taking a look at how we continue our efforts to stem the tide of the spread of the virus in the city of Denver, making sure that as a city we continue our operations and that we have the resources necessary to devote to this challenge that has befallen our city and our state and, of course, the global marketplace. But also monitoring the economic health of the city as well, and how our concerns, the concerns of this virus impacts our economic well-being. Given these concerns, I have directed a partial activation of the Emergency Operations Center where we stand. The whole objective of this operations center is to coordinate operations, resources, and messaging, and to, of course, to save the city. As you see up there is our motto in this room. Executive Director Matt Mueller will explain what a partial operation is in more detail. Our Department of Public Health and Environment is going above and beyond to ensure that every resident, business owner, and industry in our city has the best information possible to stay healthy and prepared. Bob McDonald, the Executive Director of the Department of Public Health and Environment, is here and will personally be given an update. But he's also given guidance to dependent care facilities, entertainment industry leaders, employers, and those within the justice system on protocols and best practices, and taking proactive steps that giving them proactive steps that they can take in group settings to protect the public and prevent the spread of disease. Let me pause for a moment and just remind everyone the city is still in full operation. We talked about in the first press conference making sure we don't panic, and I thought about it this weekend, all that's going on around the globe, that this city still hosted tens of thousands of people at the Oprah Winfrey event at the Pepsi Center. Today we have over 26,000 people in our city for a volleyball tournament, and we are expecting other events to continue to occur. I'm keeping a regular schedule and engaging with the public as normal. There was no off weekend for me or other people, other officials in the city of Denver. I saw the governor out, members of Congress out, doing really the same thing, reminding folks to do what's necessary to prevent the spread, but also to make sure we don't, as a community, panic and stay within our realm to address this effectively. Today, the Department of Public Health and Environment will be issuing an order for all restaurants to post public health directives on hand washing in their dining rooms and restrooms. Bob will have much more to share on that in just a moment. We know this is top of mind for a lot of our employees in the city of Denver and employees across the city. Again, the task force has been focused on that as they've met this morning as well. We're encouraging all of our city employees to, if there are concerns or issues that they need to take up with regards to this issue, that they speak with their direct supervisors. If and when it becomes necessary, each department and agency will work with employees on identifying alternatives, including working from home and telecommuting. You all know about the airport. The airport continues monitoring the situation very closely, taking additional precautions. They have installed sanitary wipes on jet bridges, as we mentioned last week, and free hand sanitizer stations, and we are continuing our efforts to spread that throughout the city as well. CDC makes a determination on which airports will receive additional screening if necessary, and again, right now, Denver is not one of them. Now I'm going to bring up Matt Mueller, the Executive Director of the Office of Emergency Management, to give us more detail about the EOC. Matt?
Right.
I'll trade places with you.
Thank you, sir. Good morning. I'm Matt Mueller. I'm the Director of the Office of Emergency Management, and the room that you are standing in today is part of our Emergency Operations Center. As the Mayor said, we activated partially today at 9 a.m. and we'll be running with the partial activation from every day for the duration for as long as this takes. That includes our Joint Information Center as well. The purpose of the Emergency Operations Center is to bring together all the resources of the City and County of Denver, as well as our partner agencies, for consolidated planning, public information, and operational coordination. We also monitor resource needs, not only for the city, but for our partner agencies as well. The focus of the Emergency Operations Center, as the Mayor detailed, is fourfold for this particular incident, the COVID-19. We're focused on public health and safety protective measures and interventions, public information and messaging to all of our community, economic impacts not only to the city, but to all of our businesses and to our residents, and then finally, continuity of government operations, ensuring that while this is going on, we are able to maintain those critical services that everyone in the city needs. And with that, I'll turn that over to our Public Health Director, Bob McDonald.
So Bob McDonald, Public Health Administrator for the City and County of Denver and the Executive Director for the Department of Public Health and Environment. I want to start out with an update on what I think most are probably interested in is how many cases do we have. And so I believe the Mayor mentioned we have 2 presumptive cases, which means that they tested positive by the state laboratory, but the protocol is that those samples will be sent on to CDC for confirmation, and we're still waiting for those test results back. We're waiting to get that announcement back from the CDC. We're not waiting in terms of protecting the public. Those 2 individuals and everyone who has been in contact with them, has been exposed or under suspicion, has been quarantined. To date, and I get updates all day long, every day, to date, none of the people that we've quarantined that have been in close contact with the 2 presumptive cases are showing as symptomatic. That's specific to Denver. We are doing a great deal, and for weeks now, you know this, that we have been reinforcing the importance of awareness, the importance of hand washing, the importance of being aware of your surroundings and isolating yourself from somebody who might be experiencing respiratory problems. We've been doing that for weeks now. But we are doing far more than that because we know that it's human nature that as humans, we often forget. During the course of our daily work, errands that we're running, the things that we do, we forget to wash our hands. That's sometimes what happens as humans. My staff are conducting thousands and thousands of visits. This started last week, getting out to the hospitality industry, thousands of restaurants, posting notices, reminding people when they most often forget to wash their hands. When they're out running their errands and they decide to go out to eat lunch or go out for dinner, they go into a restaurant and they eat. And the hand washing signs to remind people to wash their hands are often in the restrooms, but many people will eat before they go to the restroom. So we want to be proactive with reminding people immediately upon entrance to thousands of facilities to wash their hands. We're also reminding them and asking that it'll be a requirement in the venues that we're visiting. They will be issued orders to keep those reminders posted until further notice. In addition to reminding people to wash their hands when they're entering a wide range of facilities, not just the hospitality industry, but many others, that if they are experiencing symptoms, we're asking that they not enter the facility. So the hospitality industry will be posting that. I've been in touch with many managers who are managing large venues Pepsi Center and others, giving them guidance on what they could do to maintain and to avoid an outbreak or the spread within their facility. We're working closely with Denver Public Schools, the State Health Department, monitoring the guidance from CDC all day long, again, every day. We're doing a great deal with those at most risk, including persons experiencing homelessness. We have people with their boots on the ground right now, going out, trying to connect, like we always do, trying to connect persons experiencing homelessness with the city's many services to include the shelters that are available. We're trying to get them indoors like we always do because that's the safest place to be. But for those who don't make it into the shelters, we're providing hand sanitizer. We've identified where all hand sinks are available, whether they're private sector or public sector, getting that mapped, getting that information out to persons experiencing homelessness. We've been providing guidance to all the shelter operators in terms of how they can screen people coming into the shelters, how they might be able to isolate them. We are in the process of securing additional hand sinks, looking at where there might be gaps across the city, and then also providing additional hand sinks within the shelter systems. We want everybody who goes into a shelter to wash their hands before they eat. And if we have a lot of people lining up at the hand sinks that are there, that might not facilitate as much hand washing as we want. So we've reached out to our shelter providers, asking them how many additional hand sinks would they like, and we will get that there. So we're doing a great deal to keep this under control, and I think in many ways doing above and beyond what guidance is for municipalities, and we're going to limit this as best we can. And with that, I will turn it over any questions for any of us.
How many tests have been conducted in Denver?
Well, the testing requirements right now, first of all, a person has to be asymptomatic. If they're symptomatic and they have been, they've been traveling to places that are higher risk, they're going to be tested. But they could also go into a hospital setting and, in the private sector, and they could be tested there. So because of that, I can't say how many people are tested. I can tell you what the process is, and I will tell you that immediately upon being this director of the Department of Public Health and Environment at the state level, she is committed to calling the local public health directors to notify them immediately that they have a positive test. So many people have been tested, and to date, only 2 presumptive cases in the entire city and county of Denver.
Mr. Mayor, there is a major public event this coming weekend, the St. Patrick's Day Parade. Have you at all thought about potentially canceling the St. Patrick's Day Parade?
Not at this time. I was at their Grand Marshal event. I think it was Friday that I attended the event, maybe Saturday, it's Friday. Very little conversation about canceling it at this point in time.
Is there any consideration about new rules for the parade potentially? As you know, tens of thousands of people will be in downtown.
Yeah, you're right, and not at this time. I'll tell you that, Joe, we may very well have some evolving conversations during the week, so it's undetermined at this point in time, but at this point in time, I don't have any conversation or new information in terms of interest of postponing or canceling the event.
Mr. McDonald, last week you said that you disagreed with the CDC guidelines for at-risk populations regarding staying at home when possible and avoiding crowds. Do you still disagree with the CDC's guidelines?
I did not disagree last week.
You used to disagree.
Okay, well, let me answer the question and provide some clarity. I was asked a question that was taken a little bit out of context. We have been in lockstep with the CDC, and prior to answering that question, I specifically said, if you're hearing, and this was directed to the reporter who asked me the question, if you are hearing that everybody in the city of Denver, given what we have here, should not go outside, then I would disagree with that. That is what I said. But that is not what the CDC is recommending. The CDC is recommending that at-risk people, including the elderly, particularly if there's an outbreak in their community, that they should refrain from going, take precautions, refrain from going outside, certainly refrain from going to the event, and that I absolutely agree with. So I've never been in disagreement with the CDC. We've been doing everything the CDC recommends and more.
Mayor, besides the partially keeping the center open, can you provide us with other concrete examples of how the city is preparing for a possible worst-case scenario?
Well, again, the task force has been meeting, and we just had a brief conversation this morning about some of the things that they're taking a look at. First and foremost, it's about how do we make sure that we have enough resources around the city in terms of sanitation stations, hand sanitizer, make sure that the bathrooms are properly stocked with soap, and the people who are entering our facilities, libraries, rec centers, anything, our city-owned facilities, that we have the resources in place. Because it's about preparation and protecting everyone in the buildings, our city employees, as well as our visitors. The second thing that we're talking about is how do we prepare for the possibility that this virus could spread, and we have impacts in terms of the operations of the city. How do we prepare our employees to work from home? And what departments, agencies can work from home effectively without impacting our customers, the residents who depend on us every day. And so we're beginning that process to better understand how that will impact. And you may see us pilot some agencies practicing, for example, if they have to work remotely. What does it mean to be able to sign in from your home computer to the city system and make sure all that's protected and all that good stuff? Thirdly, we are talking about looking at the worst case scenario financially, economically for the city. In the event that this continues, we continue to have issues with the market, manufacturing, impacts on our revenue, our sales and use tax. How do we as a city begin today in preparation for that down the line? And we take a whole scale, from minimum impact all the way to the worst case scenario. And so we're beginning to model all of that so that we can stay as prepared as possible as a city. So that's why the task force went to work, because we want to stay ahead of all of this and to make sure that we are thinking about those scenarios. God forbid that they occur in our city in the worst case scenario.
Bob, I know we have two presumptive positive cases. The one was a woman in her 70s, correct? She traveled internationally. Not much detail has been released regarding the individual in their 40s regarding how they may have contracted this virus. Any more details you can provide on the 40-year-old and where they may have come in contact with COVID-19?
Yeah, it's my understanding that both were exposed in travel, not in this country, outside of the country. One, I believe, was Egypt. The other one was Vancouver. But they were not exposed, and there's no community transmission within the city and county of Denver. I want to make that clear. The two people that we have quarantined that were presumptive positive were exposed outside the country.
If you
said
could-
that 8 people were quarantined, or excuse me, you said that 8 people were quarantined, and you said that everyone who came into contact with those 2 people are in quarantine now. Is that really just 8 people?
8 people that are close contacts that would be at higher risk. Okay, I mean, just somebody coming in, being in close proximity to somebody else doesn't make them at high risk. We look at a number of factors to include their interactions, what took place, are they in the same household, did they travel together for long periods of time? That's all evaluated. So we believe at this point, everybody that would have been exposed that is at risk or under suspicion is quarantined.
Mr. McDonald, you just said that there is not community transmission in Denver. Our medical expert and epidemiologists say that so long as we are not testing, first and foremost, for community transmission, it's the hardest to get of the 3 testing criteria for CDPHE, that so long as we are not doing widespread testing, we are not going to know if there's community transmission until it's widespread. What gives you the confidence to state, as you did unequivocally, that there is not community transmission if we're not testing for it?
Well, let me clarify then. There's no evidence that that is occurring. There's always a possibility of non-symptomatic cases, but we're not seeing that. We're doing what we can do right now to limit that. CDC is not, we're working closely with them in terms of those very things. What's the length of term that a person could be infectious before they're symptomatic? Could it be spread while they're not symptomatic? Right now, there's nothing that confirms that people are symptomatic other than when they're not contagious, other than when they're most symptomatic. So I'm confident that we have isolated people that we're aware of that are at most at risk. But there's still a lot that's not known about the virus, and we'll continue to adjust our precautions as we learn more.
Question about the testing. Someone may not have traveled to Italy or to China, but they may have traveled extensively in the United States over the last few weeks. A person has symptoms that look like COVID-19. Can they get tested? Should they be tested? Because I have one story that was told to us where somebody went to an emergency room and they were turned away because they hadn't been to Italy or to China.
Yeah, I can't speak to that particular case. I can tell you once again what the CDC's guidelines are and what we're pushing out to the public and our partners at Denver Public Health, Denver Health and Hospital Authority, and many others, is that if they have traveled to areas where there is an outbreak within that community, and we are seeing that in the northeast, northwest and northeast part of the country. We're not seeing that here, but if they've certainly traveled to high-risk areas, and we do have some now in the United States, then they would be tested. They would meet the criteria. If they're symptomatic and they've had that type of travel, then most likely they are going to be tested. I can't speak to a situation in which somebody says they were turned away that met that criteria.
So the hospital should have that guidance.
The hospitals would have that guidance.
Mr. Mayor, a question. When we talk about flattening the curve of infection to make it easier on healthcare workers in hospitals so that when folks get sick, they don't all show up at once, but maybe we push those out over a couple of months. The scientists agree that the best way to do that is with aggressive and often mandatory social distancing, but that puts public officials like yourself in a difficult position because you would have to call for those measures before it's bad here. Because if you wait till it's bad, then you're not going to be able to impact the situation in the same way.
Mm-hmm.
How do you balance that as a public official, knowing that you would have to act before it gets bad if you want to have an impact?
I think you see us doing exactly what we should be doing. That is starting in phases, and that is the very commonsensical way to prevent the spread of this virus, or any virus for that matter. And that is constant hand washing, being precautious when it comes to greeting people. If you see someone who may be demonstrating symptoms, keeping your distance, from them. If you're not feeling well, staying at home for not only your protection but for everyone else's. And so you see us, Kyle, and doing this in phases, and obviously under the advice of public health officials or medical officials who are here as well. At the right time, they will advise me that, sir, it's time for us to take additional steps because whatever we're doing is not working. At this point in time, we're demonstrating that right now, based on the numbers, that things are working, and people are actually following through with some of the commonsensical steps. And with that said, let me just share. Someone asked about the St. Patrick's Day Parade, just like this weekend with the big event at Pepsi Center and other events are taking place. If you are not feeling well, we encourage folks not to come. And again, we'll have, I'm sure that we'll confirm all this, but all the proper stations available for hand wash and hand sanitizing. But we encourage folks who are not feeling well this weekend, if you're planning and hoping to attend St. Patrick's Day festivities, stay home if you're not doing well, and we'll work to keep everyone else safe and prepared for this crisis.
Mayor, how confident are you with area hotels having the capacity to handle this entire situation? And if you are, what gives you that sense of confidence?
It's funny you ask that question. We're going to be meeting with them later on this week, if not today, to the restaurant tours, the hotelers of the city, schools, hospitals, to get a better sense of where everyone is and their sense of confidence. But I've had some conversations again throughout all the activities. I'm talking to general managers of hotels, and while they want to make sure everyone remains safe, they continue want us to talk about making sure we do not panic as a community, and that they'll continue to take the precautions necessary to sanitize their spaces and to make sure the hotels are ready. But we'll get more information from them later on this week.
In terms of the possible economic hit, you mentioned it briefly in your opening remarks. Conventions are being canceled, it seems like by the day. Airlines are adjusting. Have you guys begun to discuss the real financial impact of the city and county of Denver?
Absolutely. Unfortunately, because of how our system works, a lot of what the impacts will be from today's activities, today's cancellations, we won't know until probably May. But that's why we're involved in the conversations right now in terms of things we need to take, precautionary steps to prepare the city for the loosening or lessening of our tax revenues that keep the city operational. Let me just give you an example of what I'm talking about. And I think he's not here, but our CFO, Brendan Hanlon, made this point very clearly. We are an entertainment city. If people don't go to the restaurant because of their concerns about this COVID-19, we don't get that back. In other words, when we get over the hump, you won't say, because I missed going to the restaurant, a month ago. I'm going to double up this week. So that's revenue that's lost forever in the city of Denver. We have to prepare for that as a city and our operations. So we're gonna do some things and communicating with our agencies and within our operations to begin everyone to think about how we can get the city through this very difficult time.
Mr. Mayor, you were talking earlier about trying to find a balance between not having people panic and doing the right thing. You're talking now about economic impacts. What impacts do you expect from the order today that businesses need to put up signage saying, you know, if you're not sick, don't, or if you're sick, showing symptoms, don't go in here. Please wash your hands before and after. You have to anticipate some sort of effect from that.
No, I'm not really, because as Bob pointed out, and I mentioned it actually in a meeting, I said, I see that in the restaurant already. But his point was, you see it when you walk into the restroom. And the point is, bring it out front. So not only the employees, but the public sees it before they walk in and sit down to begin to enjoy their meal and their experience. So it really is being more proactive. I don't really expect much of an impact from that. I think the restaurateurs will welcome the partnership with the city to make sure that we're keeping their customers safe as well as their employees. Okay? All right, thank you all.